really quick. Hey everybody, Prefer the Ages coming at you from my home. How's it going? I've come home from the hospital. Mom has been in the hospital since Monday. Today's Friday the 13th, 2024. Congratulations, it's Friday the 13th. And Friday the 13th has been quite a day to all mom's nurses at the hospital. I brought her to the ER on Monday. Let's just be more accurate, sorry. I called 911 Monday evening because she has been fighting a cough and it's been getting worse and worse and worse. And she's been on an antibiotic for suspecting pneumonia and antibiotic and prednisone. So she finished the course of antibiotic like a week beforehand. And it just didn't go away. Everything's got worse, worse, worse. So when she was choking on her phlegm because she couldn't breathe and she's coughing everything, I called 911 and had the boys come and take her off to the ER. And I did manage to get to the ER on time, pretty quick. And she has dementia. She can't tell them what's going on. So basically, after telling the EMTs what to tell the doctor 3 times as they're carting my mom out the door, because my mom has dementia, she can't advocate, she can't tell them what's going on and what's wrong. Told them, and she was still in the ER for 24 hours before there was enough room in the hospital for a hospital room for her. So she went into a hospital room with another patient. But she's been on 2 antibiotics, all week. They wanted to discharge her. They wanted to discharge her yesterday because because physical therapy had been in to help her with her motor skills. And I'm like, really? She's got severe dementia and she can't remember anything and she can't do anything. So they're not going to build up her muscles and they're not going to teach her anything. She's got severe dementia. It's not happening. So I said I wanted to talk to the doctor last night. And of course the doctor ditched me last night, which I was not happy with. It came back as, they were going to discharge her yesterday and all this was happening. So I want to talk to the doctor because I'm sure the doctor didn't know. She'd already been on an antibiotic. It hadn't worked. This is why I don't want her on the same antibiotic going home. And so I wanted to talk to the doctor before she went home. And somebody came back, good news, she's not going home today. She's going home tomorrow. I'm like, yeah, I want to see the doctor. I want to see the doctor. Ditched. Oh, total ditch. So last night I called up and I yelled at the nurse, poor nurse. And then I came in this morning and, she can't really eat on her own. So nobody had been around to feed her. Well, which is, I guess, all well and good because she couldn't recognize food. She knew there were eggs and she knew there were eggs in the tray and I'm trying to feed her eggs and she's like, rump. And then she's flapping it away or poking it away. So she didn't eat very well this morning. And then the nurse tried to come in and poor nurse she crushed all of my mother's pills. My mother has a pharmacy of pills in the morning. She crushed all of the pills. Some of those pills shouldn't have been crushed. To give with her a little bit of applesauce. Pooh! Right, into the nurse's face. Like, okay, yeah, welcome to my world. And then she tried to flush my mom's IV. My mom's fighting her. Mom, she hasn't even put anything in the IV flush yet. It's like preemptive fighting. I don't know. So she didn't know what she was doing. So anyways, that's my world. And then the doctor came in and tried to tell me that, the physical therapy has come in and they've had your mother walking up and down the hall. I'm like, that's a lie. Don't lie to me. That's a lie. Look at her. She's 89 years old. She's got full dementia. She can't even sit up on her own, much less walk up and down the hall. You look at her. And she was like, oh, we don't use that word. What, lie? I was like, yeah, she miscommunicated. They miscommunicated the truth. Oh, yes, no, yeah, I'm a little bit direct but if you're a hospital care worker, whether you're a nurse or a doctor, you see an 89-year-old patient, frail, very frail, massive dementia with pneumonia, you're going to go, next. So they came up against the immovable object that was me today. So it wasn't a very good Friday the 13th for her from the doctor or the poor nurse. The nurse did her best. We were like, I'm so sorry. I was there. My mom's aide was there. We're like, we're so sorry. So yeah. So they're supposed to bring mom home per ambulance today because there's not a Hoya lift that can put someone in a car. And what we need at that point to get her in the car and get her out of the car is really a Hoya lift because you can't get her in that car. So she's coming home by ambulance. We don't know when that's going to happen. When I went over today, I brought her clothing. Well, when anyone gets discharged from the hospital, bring them clothing, bring them socks and shoes and underwear and diaper for my mom. And I brought sweatpants and I brought a t-shirt and a sweatshirt and a jacket for my mom. For whenever they were going to bring her home. You can transfer in that. So the aide had come. So I gave them to the aide because the nurse was busy with my mom. And I said, okay, I will be stationed at home. There's supposed to also be a nurse coming today for the first time. A geriatric nurse to evaluate mom and say hi and stuff. So I need to intercept that. I need to be there for the nurse to show up. So anyways, that's my day so far, and it's 11:48. So yeah, so I'll leave you with that. Now it's kind of a quick, rapid fire what's going on with mom, but I hope mom comes home today. Her cough has eased. She was coughing yesterday at noontime bad, and her chest was heaving after coughing, but she hasn't been like I visited her last night, and she wasn't doing that. I sat with her this morning. She wasn't doing that. So she is getting better slowly but surely. But there's a fine balance between keeping her in the hospital until she resolves more and having her in the hospital just she's exposed to all sorts of germs and whatnot. And she can't afford to get the flu at this point. She can't afford to get the flu. She can't afford to get a cold. She can't afford to get COVID. She can't afford to get any of that. So we'll bring her home between me and the aide. We will resume our 24/7 surveillance care. So yeah, and then mom will feel a little bit better just being around, and we're hoping that some of the violence is hospital dementia rather than regular dementia, and then she will just resume her regular dementia when she gets home. So, anyways, that's where we are at this point. Okay, all right. More to come. I want to talk about other things, but this, you've heard me long enough. Thank you for listening to me. You're my therapy. Maybe I should make that myself. You're my therapy. Thank you for listening to me. But it's true. It's true. All right. Okay. I hope this finds you well. I have to go find my dog who's outside probably eating sticks. Okay. All right. Hope this finds you well. Take care. Bye.